Have you ever felt like a medical detective piecing together clues to solve a patient's puzzling symptoms? I know I have. The challenge of navigating medical complexity contains both the most frustrating and exciting elements of medical speech pathology. The good news is the solution is often not in pursuing every expensive and complicated test under the sun. The answer may lie in the oldest medical tools in history, our eyes and our ears. Hi, I'm Teresa Richard. I've been a medical speech pathologist since 2008. I'm a board-certified specialist in swallowing and swallowing disorders, and I'm the founder and CEO of the MedSLP Collective and MedSLP Education. Author of the best-selling book, So You're Having Trouble Swallowing, and host of the Swallow Your Pride podcast, which has over 5 million downloads. Welcome, I am so glad you are here. The power of the patient interview. In the world of high-tech medicine, we sometimes forget the power of simply listening to our patients. Active listening involves not just hearing the words, but truly understanding the patient's perspective and emotions. It means asking open-ended questions, giving the patient space to share their story, and resisting the urge to interrupt or jump to conclusions. It might sound easy, but it's not. Listening is like holding a fragile egg. If you hold it too tightly, you'll crush it. But if you hold it too lightly, it will slip through your hands and explode on the floor. Listening, similarly, requires the right balance between being attentive and engaged without interrupting or taking over the conversation. Research has shown that active listening can lead to more accurate diagnoses, improved patient outcomes, and greater patient satisfaction. It also strengthens the therapeutic relationship and builds trust between the patient and clinician. One study showed that the patient interview results in an accurate diagnosis between 70 to 90% of the time. Whoa. To put that into perspective, an X-ray of the chest, one of our top go-to assessment tools in medical care, is only 38 to 76% accurate. Yikes. A patient, we'll call him Mr. Jones, presented with difficulty swallowing. The SLP, instead of diving straight into an oral motor exam, sat down and listened as Mr. Jones described his symptoms, his worries, and his experiences. Through careful listening, the SLP uncovered a crucial detail. Mr. Jones' symptoms worsened significantly after periods of stress. This insight guided the SLP to explore the possibility of a psychogenic dysphagia component, a factor that might have been missed with a less thorough approach. Observation is key, unlocking the silent narrative. Sometimes the most valuable clues are not spoken, but rather hidden in plain sight. As SLPs, we are trained to not only listen with our ears, but also to observe with our eyes, gathering crucial information that the patient themselves may not even be aware they are conveying. Nonverbal cues are a language all their own, whispering volumes about a patient's condition and overall well-being. Pay close attention to the patient's body language, facial expressions, and overall demeanor. Are they sitting comfortably? Do they appear anxious or distressed? Are they making eye contact? These subtle cues can provide valuable insights into their emotional state, their level of comfort, and their understanding of their condition, often before they even speak a word. While we are experts in the intricacies of the oral motor mechanism, observation extends beyond just the mouth. Notice the patient's posture, their alertness, their breathing patterns, their skin quality, and their ability to feed themselves. These observations can reveal a wealth of information about their physical health, their mentation, and their ability to participate in the evaluation and follow-up interventions. For example, a patient with Parkinson's disease may exhibit tremors or rigidity, which could impact not only their swallow, but their ability to effectively feed themselves. A patient with chronic obstructive pulmonary disease may have a high respiratory rate or may fatigue easily, which could interfere with the sensitive breathing, swallowing coordination, and their endurance during a meal. Like any skill, observation requires practice and refinement. The more patients you see, the more attuned you become to the subtle nuances of human behavior and physiology. Each patient interaction is an opportunity to hone your observational skills and to notice the subtle cues that others might miss. Don't hesitate to seek mentorship from experienced colleagues, attend workshops on clinical observation, or engage in peer-to-peer case reviews to develop this essential skill. An SLP entered the hospital room to evaluate a patient with a history of stroke. Before even starting the formal assessment, the SLP observed the patient struggling to sit upright, their breathing labored, and their face pale. These observations immediately raised concerns about the patient's respiratory status and potential aspiration risk. Even before the patient uttered a single word, the SLP decided to defer the swallowing evaluation and immediately notify the medical team of her concerns, potentially preventing a serious aspiration event. Most importantly, the team was able to attend to the patient early, possibly avoiding an episode of respiratory failure. Are you finding this exploration of dysphagia as fascinating as I am? If so, hit that like button and subscribe to stay in the loop for more insightful videos. Now, I know you're probably brimming with questions about the art of observation and active listening in dysphagia management. What are you eager to learn more about? Share your thoughts and queries in the comments below. Let's get the conversation going. And don't go anywhere just yet. I've got an exclusive resource waiting for you at the end of this video that you definitely don't want to miss. Thinking slow. In the fast-paced world of healthcare, it's tempting to jump to conclusions, but slow thinking is essential for an accurate diagnosis and effective treatment. Premature closure is a cognitive bias that occurs when we settle on a diagnosis or explanation too early in the diagnostic process, without fully considering all available information or alternative possibilities. This bias can lead us to overlook crucial details, misinterpret information, and make inaccurate judgments. It's like trying to solve a puzzle by forcing the pieces together without carefully examining their shapes and patterns. In the context of dysphagia management, premature closure can result in misdiagnosis, inappropriate treatment recommendations, and missed opportunities to address the underlying causes of a patient's swallowing difficulties. And if we fail to address the underlying cause, even if we successfully treat the prevalent symptoms, we will still fail to prevent the issue from occurring again. Like a Med-SLP version of whack-a-mole, we are endlessly scraping away at the surface without digging deep into the problem and addressing the core issue. Premature closure bias can lead to misdiagnosis, unnecessary interventions, and missed opportunities for effective treatment. It's crucial to keep an open mind, consider all possibilities, and gather sufficient evidence before settling on a diagnosis or treatment plan. An SLP received a referral for a patient with suspected aspiration pneumonia. The patient had a history of dementia and had recently experienced a decline in their oral intake. The SLP, mindful of the potential for premature closure bias, decided to conduct a thorough evaluation, including an instrumental swallowing evaluation, before making any recommendations. The study revealed that the patient's aspiration was not as severe as initially suspected, and the SLP was able to recommend a less restrictive diet modification that allowed the patient to continue enjoying mealtimes. Strategies to avoid premature closure. Challenge your assumptions. Don't just accept the first explanation that comes to mind. Ask yourself, what if my initial diagnosis is wrong? Consider alternative scenarios and actively seek evidence that might disprove your initial assumptions. For example, if a patient presents with coughing after meals, don't immediately assume aspiration. Explore and rule out other possibilities, such as a respiratory infection or a reflux-related cough. Seek alternative explanations. Brainstorm a list of possible diagnoses or contributing factors, even if they seem unlikely at first. Dust off your textbooks, read research articles, and take courses to expand your understanding of the condition and consider a wider range of possibilities. For instance, if a patient exhibits difficulty chewing, explore potential causes beyond oral motor weakness, such as dental pain or ill-fitting dentures. Consult with colleagues. Discuss the case with other SLPs and medical team members. A fresh perspective can help you identify blind spots and consider alternative viewpoints. Sharing your reasoning and seeking feedback from colleagues can expose you to new ideas and prevent you from getting stuck in a single line of thinking. Gather additional data. Don't hesitate to order additional tests, consult with other specialists, or conduct further assessments to gather more information if needed. For example, if a FEES is inconclusive, consider a modified barium swallow study to get a clearer picture of the oral and esophageal phases of the swallow. Additionally, review the patient's medical records, interview family members, and consider any relevant social or environmental factors that might be contributing to the patient's condition. Remain open to revising your diagnosis or treatment plan as new information becomes available. The assessment and treatment process is dynamic. Be flexible and willing to adjust your approach as the patient's condition evolves or new information emerges. Continuously monitor the patient's progress, reassess their needs, and modify the treatment plan accordingly. For example, if a patient is not responding to a particular therapy approach, be open to trying alternative techniques or seeking additional consultations. A young SLP fresh out of grad school was eager to apply her knowledge. She received a referral for a patient with a history of Parkinson's disease who was experiencing swallowing difficulties. Her initial assessment pointed towards recommending a modified diet. However, remembering the importance of avoiding premature closure, she decided to slow down her thinking. She challenged her initial assumptions by digging deeper into the patient's medical history and found a recent notation about dental discomfort. Conducting a more thorough interview with the patient revealed ill-fitting dentures as a major contributing factor to the patient's swallowing difficulties. By remaining open to alternative explanations and gathering additional data, she avoided unnecessary dietary restrictions and collaborated with the patient's dentist to address the root cause of the problem. This collaborative, thinking slow approach led to a more effective and patient-centered solution. Ready to become a medical detective and unravel the mysteries of dysphagia? As we talked about, the best way to get an accurate view of the full picture is to dive into the research, take courses, find a more experienced colleague, discuss with a community of MedSLPs. What's the best way to do that? Join the Medical SLP Collective. You can find us at medslpcollective.com. Take a look at our free MedSLP clipboard kit to support your practice and get you started. The link is in the description. Thanks for watching.